name's Lota. I'm a second-year biochemistry major, and about a year ago, around this time, I was in one of the I&I research committees, and I was looking and studying at ITMS, which is a form of neuromodulation. And at that time, I was wondering, is there a way that I could apply this to pain management? And that was when I found my very first Scrambler article, which absolutely blew me away from the start, from just the methodologies, the results, and everything, and has started this year-long passion in trying to further develop my knowledge on it. So I'm very excited to introduce you guys to my presentation on Scrambler therapy, a retrospective and prospective study on optimizing Scrambler therapy in long-term and what clinical and demographic aspects contribute to that. So I've said Scrambler like 5 times in the last minute, and I'm sure you're wondering what the heck I'm talking about. Scrambler therapy is a non-invasive treatment. It's a form of neuromodulation, which means it administers small electric pulses to the patient, and that is done through attaching electrodes to patient dermatomes, which correspond to their pain sites. And so it is built off of the neuromatrix theory, or it is based off of the neuromatrix theory, which postulates that pain is just a brain-perceived experience that is contributed to multiple neural circuits. And so to get a little bit more into the theory of action, okay, so there was a slide for this. To get a little bit more into the theory of action, if I were to stub my toe, I would feel that pain. My toe would send a neurochemical signal up my body to my brain and tell my brain I'm in pain, and I would perceive that pain from a brain perspective as well. Now, imagine if I were to stub my toe and 3 months later, I still felt that pain. 6 months later, still was feeling that same pain, maybe 9 months later. That is what a chronic pain patient experiences. And so, essentially what happens is they have these erroneous pain signals that their peripheral neurons are sending to their brain, consistently saying, we're in pain, we're in pain, we're in pain. And so what Scrambler does is, through these biosynthetic signals that are administered through the electrodes, they send a non-pain signal. And our brain recognizes these signals as our own because they're so similar to the action potentials that our own body generates. And so through multiple treatments, the idea is that these non-pain signals will overshadow the pain signals, kind of playing on the principles of neuroplasticity, in that we can reshape the way that our neurons experience things. And so within the first 5 or 10 minutes, the patient's pain should completely zero out. So a little bit of previous data. Here in figure 1, we can see the VAS scores between pharmacological intervention and Scrambler therapy intervention. And we can clearly see a drop in VAS, which is a common metric for pain measurement scales. And so we can also see in figure 2 the medication reductions after that kind of treatment in Scrambler. And so we see here that 72% of patients in this trial completely discontinued their pain medications, and the remaining 28% reduced their dosage. That is 100% of positive feedback to the treatment. And while the numbers themselves are very impressive, I think a lot can be said about the patient and physician testimonials. I actually had the privilege of seeing this patient, Patient J, who I will name as Patient J for confidentiality reasons, but CRPS all along the front side and back side of his abdomen, complex regional pain syndrome, after a spinal surgery. And so I got to experience his very first Scrambler treatment, which, as you can imagine from a patient perspective, has to be absolutely insane. I mean, he's had pain in his back and abdomen for years now, and it is completely zeroed out in a span of 10 minutes. And so typically patients will have a ton of relief from this. Within the first few treatments, about like an hour or so afterwards, they'll be completely pain-free. And after 10 treatments, typically, if done correctly, it'll be completely eliminated. Now, I know in short term and durationally that this is a successful device and intervention, but what I want to know is the long term. What kind of demographic, what kind of clinical aspects contribute to whether or not Scrambler will be effective for a patient. So what I'll be doing is I'll be going into de-identified patient data, and I will be administering surveys in which I will be looking at the primary outcome, which will be VAS scores, or a pain metric. And ideally, I would also like to look at secondary outcomes like psychological changes or medication decreases, as that would be interesting to also look at. However, this is very data dependent on what is provided to me. In terms of eligibility criteria, I would like the patient to have had Scrambler within the last 5 years, have at least 3 VAS scores taken down, and have a neuropathic pain diagnosis of some sorts. In terms of the survey themselves, it will kind of just ask about the general gist of their Scrambler experience and their current VAS. So when they last had Scrambler administered to them, what their current level of pain is, and how they would describe their pain in the time spans of 6, 12, and 24 months in between now and when they had received treatment. To maintain objectivity, I was actually advised by the inventor of the device that there are certain things that I should pay attention to in the data that I collect. And so one of those things is paying attention to the physician and how experienced they are in administering Scrambler, as their training levels can be incredibly impressive on whether or not the treatment will work. So that is one of the factors. The other factor is non-progressive and progressive pain syndromes have to be evaluated separately. As you can imagine, if someone were to have a progressive pain syndrome, they would want to come back to relieve that pain as it continues to spread through their limb. And that can kind of deplete the efficacy of Scrambler, at least in terms of optics. So you might be asking what the clinical relevance of this might be. And to that I say, Scrambler therapy has, like I said, demonstrated extreme success in durational use with limited information for the actual longevity of it. And so it would be incredibly helpful in coming up with a better treatment trajectory for patients. Additionally, it's currently uninsured, which is part of the reason it is not a mainstreamed device for pain management. Having it be uninsured, it is rather expensive. Patients are not going to be wanting to get such an expensive treatment without having insurance covering it. And it is currently in an investigational standpoint. So if we are able to further collect information on Scrambler and how it helps patient populations, my hope is that one day it will be a more widely accessible device. In terms of current status and future directions, I'm collaborating with a couple of physicians to kind of refine the scope of this study, and we are currently writing up the IRB to submit and are further exploring our opportunities with the Scrambler distributor here in the US, and so we will be meeting later this month to hopefully finalize all that before we get started this summer. Ultimately, if successful, I would love for this to be part of refining treatment trajectory, ensuring Scrambler, and opening it up to the public as a widely used pain management device. So here are my references. Thank you guys so much for listening.
All right, wonderful job, Loda. Does anyone have any questions for her?
Thank you so much, Sharlotta. That was incredible. Vokshur, founder of INI. Just wondering, I didn't hear about the why this technology is like different than a regular TENS unit. I may have missed some of the beginning. Can you explain that again?
Yeah. So TENS, typically, the way it's administered is it's only effective durationally while you're using it. And that's just simply because of the way that it's administered. Scrambler has different modalities where the patterns at which they administer the electric pulses are different than a TENS unit. And so because these patterns are more similar biologically to our own currents, it is also more effective in the long term as something that is rerouted with like neuroplasticity.
And I'm sure it's like some proprietary pattern that they've figured out, but is it like a TENS where you can increase the intensity and decrease it? And is it like a TENS that it can go, it goes only to like maybe subcutaneous level, or does it have other effects? Like, PEMF devices have a magnetic component that can go, much deeper. Is it only electrical, or do you know?
Yeah, so a Scrambler is larger than a TENS in terms of the actual unit. It is the same in that you can change the voltage with a dial. There are 16, I think, predetermined signal patterns that they can administer with that voltage change as well. And so it like kind of repeats the same 16 until it zeroes out the patient, at which point they stop playing with the dial and things like that. In terms of other like actual effects, it is purely electrical. There's no like magnetic component to deeper the sensation or whatnot, but it is completely subcutaneous, or not subcutaneous. It is above the skin, non-invasive, just with electrode use.
I know I'm asking way too many questions. This is absolutely fascinating because I'm a spine surgeon and I deal with chronic pain a lot. And some of the younger people with chronic pain, like your patient, are very challenging. So I would like to volunteer myself and our practice as part of your research protocol, as well as the IRB abilities. And I know Jack's been helping out as well. So I think this is really fascinating and love your talk. Thank you.